Social work is concerned with helping individuals, families, groups, and communities to enhance their individual and collective well-being through their own resources and community programs and services.
Occupational therapy enables individuals to engage in activities that are meaningful to them. So this includes work life, home life, and leisure activities.
Paramedics are the first line of medical service during an emergency situation, and due to this, they often encounter traumatic events such as car accidents. Paramedics perform many occupations, including CPR and emergency respiratory procedures. Paramedics often experience post-traumatic stress disorder, which is the constant re-experiencing of a traumatic event, causing the individual to become emotionally numb. Some symptoms include chronic anxiety and trouble concentrating. Paramedics in Nova Scotia are expected to perform shift work involving 2 day shifts, 2 night shifts, followed by 4 days off. The Paramedic Association of Canada outlines the professional responsibilities expected of paramedics. Paramedics are expected to work under pressure and remain calm while doing so. Paramedics experiencing PTSD may have difficulty transitioning back to work.
Paramedics living with PTSD often experience headaches, high blood pressure, and fatigue. Also, vivid memories of the trauma can cause high levels of adrenaline in the body for a prolonged period of time, this causing the person to feel tense, irritable, and unable to sleep or relax. Impaired concentration, reasoning, and/or judgment may also be affected, causing a delay in the person's ability to follow protocol and provide proper treatment to patients. Paramedics may also experience emotional numbness, anxiety, depression, anhedonia, hypervigilance, and exaggerated startle response.
These factors can also impact one's relationships with others and cause them to avoid previously enjoyed activities.
For the institutional aspect of the environment, there are different policies across Canada for requirements to be a first responder. Usually the costs are absorbed by municipality costs, as these people are already paramedics, firefighters, and EMT. Their social supports are mainly consisting of peers and coworkers. Family and friends are very important. There's a culture of prioritization of individual injuries in order to save the majority. And their physical environment can be just about anything.
The key challenges for the field of paramedicine, as agreed upon by our interprofessional team, are as follows: work environment and structure, recognition and respect from society, mental health, and subculture of bravery, desensitization, and non-expression of emotion.
As occupational therapy is client-centered, our primary focus is to get individuals back to working at an optimal level while minimizing negative symptoms of PTSD. This could include promoting work-life balance, implementing meaningful activities during work downtime, and advocating for policy or institutional changes.
If we make the recognition of PTSD a society-wide issue, we can then acknowledge that this form of work environment is reinforcing the development of mental health concerns and crises. The onus is on society to push for systemic changes and consciousness raising surrounding the prevalence of PTSD in the paramedic community. In order to support this population, we recommend the implementation of specialized counseling with a professional rather than relying on peer support solely. Peer support can also play an informal role through making use of downtime and debriefing among similarly experienced individuals.
Challenges of interprofessional work include scheduling, navigating conflict, maintaining client-centeredness, and ensuring a respectful relationship. Some benefits include having opportunity for knowledge sharing, improving client outcomes, and being exposed to new views and concepts.